And questions they are going to ask in this plasma proteins are: name major plasma proteins, how they are going to separate plasma proteins, and their normal values for 5 marks. Other 5 marks questions are acute phase proteins, acute negative phase proteins for 3 marks. Some of the globulins, alpha and beta globulins, may be asked for 3 marks, and one more 3 or 5 marks question is acute negative phase protein, C-reactive protein, and also Ben Jones proteins or multiple myeloma for 3 marks or maybe 5 marks. Coming to plasma proteins, if blood is mixed with an anticoagulant and centrifuged, cell components are precipitated and the supernatant is called as plasma. If blood is withdrawn without any anticoagulant and allowed to clot, after 2 hours, liquid portion is separated from the clot called as serum, which lacks coagulation factors including prothrombin and fibrinogen. Plasma contains hundreds of different proteins. The major proteins present in the plasma are albumin, globulins, and fibrinogen. All the plasma proteins are synthesized in the liver except immunoglobulins, which are synthesized in the plasma cells and reticuloendothelial system. Coming to different methods for separation of plasma proteins. Some of the methods for separation of plasma proteins are salting out method, consfractionation, electrophoresis, and centrifugation, ultracentrifugation. Coming to salting out method. By salting out method, the major proteins present in the plasma like albumin, globulin, and fibrinogen are separated by using ammonium sulfate. Sodium sulfate is also used for separation of these proteins present in the plasma. Albumins are precipitated by full saturation with ammonium sulfate, globulins by half saturation with ammonium sulfate, and fibrinogen by 1/5 saturation with ammonium sulfate. Coming to consfractionation, the scientist Kahn used varying concentration of ethanol to separate plasma proteins. Fraction 1 is rich in fibrinogen, fraction 2 is rich in gamma globulin, fraction 3 contains alpha and beta globulins, fraction 4 consisting predominantly of albumin. Third method for separation of plasma proteins most commonly used is the most commonly used separation technique in clinical laboratory to separate plasma proteins, amino acids, enzymes, nucleic acids, hemoglobin variants, etc. Electrophoresis refers to the movement of charged particles through an electrolyte in an electrical field. Of course, we are going to discuss this electrophoresis in detail, this technique in detail in practicals under demo practicals. Coming to different types of electrophoresis: agar gel electrophoresis, polyacrylonitrile gel electrophoresis, cellulose acetate electrophoresis, immunoelectrophoresis are some of the important types of electrophoresis. This is the normal, serum, and plasma electrophoretic pattern. Here this is an agar gel electrophoresis. The point of application, sharp line indicates point of application. You are going to apply the sample, that is serum, plasma, or maybe urine is also used. Minus I, you are going to apply the sample. In number 1 indicates it is a normal serum electrophoretic pattern. Albumin is the fastest moving plasma proteins, moves very fast towards positive charge. Albumin followed by alpha 1, alpha 2, beta, and gamma globulin. In case of plasma, if we apply the plasma or plasma electrophoresis, shows fibrinogen band in between beta and gamma globulin, and this may be mistaken for paraproteidic band or M band. This agar gel electrophoretic slide shows number 1 normal serum electrophoretic pattern, number 2 it is a diseased condition, multiple myeloma. In case of multiple myeloma, M band or multiple band or paraproteidic band appears in between beta and gamma region. Sometimes this M band in case of multiple myeloma may appear in gamma region or at the point of application also. This agar gel electrophoretic slide shows number 1 it's a normal serum electrophoretic pattern, number 3 it's a case of disease, chronic infection. In case of chronic infection, broad based increase in gamma region, general increase in alpha 1 and alpha 2 bands. This is an agar gel electrophoretic pattern in case of nephrotic syndrome. Number 1 indicates normal serum electrophoretic pattern. Number 4, it's a case of nephrotic syndrome. In case of nephrotic syndrome, there may be a severe hypoalbuminemia and also there is a prominent alpha 2 band. This is a electrophoretic pattern in case of cirrhosis of liver. In case of cirrhosis of liver, albumin is very much decreased. There is a severe hypoalbuminemia. This hypoalbuminemia in case of cirrhosis of liver is due to decreased synthesis of albumin in the liver. Coming to functions of plasma proteins, these plasma proteins plays an important role in maintaining internal colloidal osmotic pressure, and also transport of various substances in the blood, plays an important role in defense mechanism, plays an important role in inflammatory reactions, plays an important role in buffering action, helps in maintaining viscosity of blood, plays an important role in blood coagulation, and also these plasma proteins having a nutritive function. These are some of the important functions of plasma proteins. Coming to normal values, normal serum protein concentration ranges from 6 to 8 grams per deciliter, albumin 3.5 to 5 grams per deciliter, globulins 2.5 to 3.5 grams per deciliter, whereas fibrinogen concentration ranges from 200 to 400 milligram per deciliter. The albumin globulin ratio normally ranges from 1.2 is to 1 to 1.5 is to 1. Coming to individual plasma proteins, it is the major plasma protein, simple protein, synthesized in the liver, having a molecular weight of 69,000, and it has one polypeptide chain with 585 amino acids, having 17 interchain disulfide bonds. And this albumin is separated from the plasma by using ammonium sulfate, and it is precipitated by full saturation with ammonium sulfate, and it is the fastest moving plasma protein in electrical field because of low molecular weight. Normally, it ranges from 3.5 to 5 grams per deciliter. It is estimated quantitatively by Bromocresol Green method or BCG method, are also called as dye binding method. Some of the important functions of albumin are: albumin helps in maintaining internal colloidal osmotic pressure, helps in transport of various substances in the blood like bilirubin, fatty acids, thyroxine, vitamin A, calcium, and certain drugs like sulfonamides, aspirin, penicillin, etc. Albumin plays an important role in buffering action. Albumin also helps in maintaining viscosity of blood, and it has a nutritive function. Coming to therapeutic uses of albumin. Albumin is used in patients with hypovolemia, maybe due to injury or surgery or burns, and also in case of severe hypoalbuminemia, sepsis, and acute respiratory distress syndrome. Coming to globulins, another major protein present in the plasma, having a molecular weight of 90,000 to 130,000. These globulins are precipitated by off saturation with ammonium sulfate. By electrophoresis, globulins are separated into alpha 1, alpha 2, beta 1, beta 2, and gamma globulins. Alpha and beta globulins are synthesized in the liver, whereas gamma globulins are synthesized by reticuloendothelial system. Alpha 1 globulins includes alpha 1 acid glycoprotein, alpha 1 beta phytoprotein, alpha 1 antitrypsin, retinol binding protein, and HDL. Alpha 2 globulins includes ceruloplasmin, haptoglobin, and alpha 2 macroglobulin. Beta globulins are transferrin, hemopexin, beta 2 macroglobulin, C-reactive protein, and LDL. Gamma globulins are nothing but immunoglobulins. Some of the clinically important alpha 1 globulins are alpha 1 acid glycoprotein. It is synthesized in the liver. It is an acute phase protein. Its concentration is decreased in liver disease, nephrotic syndrome, and malnutrition. Alpha 1 phytoprotein. It acts as a tumor marker for hepatocellular carcinoma. Estimation of alpha 1 phytoprotein in amniotic fluid and plasma is helpful in the diagnosis of neural tube defect, in which its concentration is increased. Alpha 1 phytoprotein concentration is decreased in Down syndrome. Alpha 1 antitrypsin. It is synthesized in hepatocytes. It has a single polypeptide chain with 394 amino acids. It is also called as serine protease inhibitor, which inhibits the activity of an enzyme, serine protease. Deficiency of alpha 1 antitrypsin causes emphysema of the lung, and also its concentration is decreased in liver diseases, nephrotic syndrome, etc. This alpha 1 antitrypsin acts as a tumor marker for germ cell tumor of testes and ovary. Coming to alpha 2 globulins, some of the clinically important alpha 2 globulins are ceruloplasmin. It is a glycoprotein. It is a copper containing enzyme. It is synthesized in the liver, and it is an important plasma antioxidant. It has a ferroxidase activity, and it converts ferrous iron into ferric iron, and thereby helps in incorporation of iron into transferrin. Normal serum ceruloplasmin concentration ranges from 25 to 50 milligram per deciliter. Its concentration ranges from 25 to 50 milligram per deciliter, and its concentration is decreased in Wilson's disease, liver diseases, nephrotic syndrome, and malnutrition. If the serum concentration goes below 25 milligram per deciliter, it is an indicator of Wilson's disease. Coming to haptoglobin, glycoprotein, it is synthesized in the liver. It binds with free hemoglobin and thereby prevents the excretion of hemoglobin in the urine. It is an acute phase protein. You will come to know what you mean by acute phase protein shortly. Its concentration is increased in all inflammatory conditions. Beta globulins. The major beta globulins having clinical importance are transferrin, hemopexin, CRP, and LDL. Coming to transferrin. Transferrin is a glycoprotein, non-heme iron containing protein with molecular weight of 70,000. It is the transport form of iron, and it is a transport protein. It is synthesized in the liver. It is an acute negative phase protein. Normal serum transferrin concentration ranges from 200 to 300 milligram per deciliter. Its concentration is increased in iron deficiency anemia, and transferrin concentration is decreased in PEM, protein energy malnutrition, nephrotic syndrome, malignancies, and in muscle wasting diseases. Beta 2 macroglobulin, it has a low molecular weight peptide consisting of 100 amino acids present in urine, less than 0.01 milligram per deciliter, and its normal serum concentration is about 2.5 milligram per deciliter. And this beta 2 macroglobulin concentration is increased in multiple myeloma, lymphoid leukemia, lymphomas, and also in renal diseases. Coming to C-reactive protein, it is named because it reacts with polysaccharide of capsule of pneumococci. It belongs to beta 2 globulin consisting of 5 polypeptide subunits, and it has a disc-shaped polymer having a molecular weight of 115 to 140 kilodaltons. C-reactive protein is synthesized in the liver, and it stimulates complement activity and macrophage phagocytosis. It is an acute phase protein, and C-reactive protein concentration is increased in all inflammatory conditions. Increased hsCRP level, C-reactive protein level in blood indicates the risk of coronary artery disease. Fibrinogen, it's a glycoprotein synthesized in the liver, having a molecular weight of 350,000, precipitated by 1/5 saturation with ammonium sulfate, and it is an acute phase protein. Fibrinogen normally ranges from 200 to 400 milligram per deciliter or 0.2 to 0.4 grams per deciliter. It is also called as clotting factor 1. It is mainly involved in coagulation of blood and also helps in maintaining viscosity of blood. Coming to clinical importance of plasma proteins, hypoproteinemia means decreased serum total protein concentration below the normal range is called as hypoproteinemia. This hypoproteinemia is also called as hypoalbuminemia because in case of hypoproteinemia, mainly albumin concentration is decreased. Some of the important causes for hypoproteinemia are hemodilution, or it may be due to decreased synthesis of albumin. The causes for decreased synthesis of albumin are chronic liver diseases, malnutrition, malabsorption syndrome, etc. And this hypoproteinemia also may be due to increased excretion of albumin in urine. Some of the important causes for increased excretion of albumin from the body are burns, nephrotic syndrome, multiple myeloma, protein losing enteropathy, etc. In case of cirrhosis of liver, PEM, nephrotic syndrome, multiple myeloma, AG ratio is altered because in these conditions albumin concentration is very much decreased and globulin concentration remains normal or slightly increased. Edema occurs when the total serum protein concentration goes below 5 grams per deciliter and the albumin concentration below 2 grams per deciliter. Of course, there are different types of edema like nephrotic syndrome. In case of nephrotic syndrome, you will get facial edema. In case of cirrhosis of liver, you may get an ascites. Ascites is nothing but accumulation of fluid in the abdomen. And maybe pitting edema. One of the important cause for pitting edema is congestive cardiac failure. Coming to hyperproteinemia. Increased total serum protein concentration more than normal is called as hyperproteinemia. This is mainly due to increased serum globulin concentration. Hence, hyperproteinemia is also called as hypergammaglobulinemia. Some of the important causes for hyperproteinemia are maybe hemoconcentration, systemic lupus erythematosus, tuberculosis, chronic infections, and one more very, very important cause for hypergammaglobulinemia is multiple myeloma. Coming to transport proteins in the blood. Again, it is a very, very common 5 marks or sometimes maybe 3 marks question. Blood is a water medium, so lipids and lipid soluble substances will not easily dissolve in the blood. Such molecules are carried in the blood by specific carrier proteins called as carrier or transport proteins in the blood. Some of the examples for transport proteins in the blood are albumin. Albumin transports fatty acids, bilirubin, calcium, copper, drugs like sulfonamide, salicylates, steroid hormones, and penicillin in the blood. Prealbumin transports thyroxine, retinol, and steroid hormones. Thyroid binding protein transports thyroxine. Hemopexin transports free hemoglobin. Haptoglobin transports hemoglobin. Transferrin transports iron. Ceruloplasmin transports copper in the blood. LDL transports cholesterol, phospholipids, and also triacylglycerols in the blood. HDL helps in transportation of cholesterol in the blood. Coming to acute phase proteins, the level of certain proteins in the blood may increase 50 to 1000 folds of their normal values in various inflammatory conditions. Such proteins are called as acute phase proteins. Some of the important acute phase proteins are C-reactive protein, CRP, ceruloplasmin, alpha-1 antitrypsin, alpha-1 acid-glycoprotein, haptoglobin, alpha-2 macroglobulin, and fibrinogen. Coming to acute negative phase proteins, the level of certain plasma proteins in the blood may decrease below their normal values in various inflammatory conditions. Such proteins are called as acute negative phase proteins. Examples for acute negative phase proteins are albumin, prealbumin, retinol binding protein, and transferrin. Coming to Bence-Jones proteins, they may ask as multiple myeloma. These are abnormal proteins present in the blood and urine sample of patients suffering from disease called as multiple myeloma, which is a plasma cell cancer. This multiple myeloma is a plasma cell cancer. In multiple myeloma, there is an increased concentration of immunoglobulins in the blood, usually IgG and IgA. Light chains are produced in excess, then heavy chains in the blood. Because of low molecular weight, these light chains because of low molecular weight, these light chains of immunoglobulins easily passes through glandular membrane and appears in the urine. Multiple myeloma is a malignant plasma cell tumor of bone characterized by paraproteinemia, lytic bone lesions, anemia, spontaneous pathological fracture of bone. X-ray shows punched out osteolytic lesions. Some of the biochemical changes in case of multiple myeloma are there may be an hypercalcemia, that is increased blood calcium level. There may be an increased excretion of calcium in urine leading to hypercalciuria. There may be a hypergamma-globulinemia, increased gamma globulins in the blood. There is an increased beta-2 macroglobulins in blood, and also there is a reversal of albumin globulin ratio. Coming to diagnosis of multiple myeloma. Number 1, heat test. Number 2, broad shot test and electrophoresis. Heat test, commonly used bedside test for the diagnosis of multiple myeloma. When urine is heated at 50 to 60 degrees centigrade, the precipitation occurs. On further heating, precipitation disappears, and again on cooling, precipitation reappears. The second method for diagnosis of multiple myeloma is broad shot test. When concentrated HCl is added to urine, a white ring appears between two layers, and it is an indicator of multiple myeloma. Electrophoresis is the commonly used technique for the diagnosis of multiple myeloma, but it takes a longer time. Appearance of M band or paraproteinic band in between beta and gamma region, or maybe in the gamma region only, indicates a case of multiple myeloma. Here are some of the important assignment questions. Short essays: name major plasma proteins and their normal values, and how you are going to separate plasma proteins. Number 2, transport proteins in the blood. Bence-Jones proteins or multiple myeloma. Short answer questions are acute phase proteins, acute negative phase proteins, C-reactive protein, hypoalbuminemia, ceruloplasmin, and alpha-1 antitrypsin. Thank you.